So today we'll be seeing a very interesting CT scan of the abdomen. Now this is obviously CT scan of the abdomen because we can see this liver is there, the spleen is there, and other abdominal organs are there. So these are the hip bones, this is femur, and this is sacrum, this is sacrum, this is sacrum, this is very well noticeable bone. So we can see this is the area which we are focusing. This is abdomen and these are the thighs. So it's very easy to recognize this is the right side, this is the left side. We can see this is all liver, and on CT scan of the abdomen, liver and spleen should have same radio density. So this is the spleen and this is the liver, and this is the normal sized liver. This is the normal sized liver, which is almost like 1/5 to the size of the liver. It is present on the left side and this is present on the right side. So this is all liver which is coming almost up to the center and towards the left side of abdomen also. Now this is the liver which is perfectly fine, spleen is perfectly fine. We can see the margins of the liver is very well preserved, and the spleen margin is also very well preserved. There is no discontinuity or any lesion or any mass or any problem in the spleen which is visible. Now the next organ in the abdomen is stomach. It is very easy to identify stomach. Stomach will be present on the left side of the abdomen if there is no inversus. So it will be present in the left side of the abdomen. Very commonly the stomach will have gas, and stomach will also have some fluid or some food. So fluid and gas will give the stomach air fluid level, which is very typical of stomach because stomach has a large diameter. So this on the left side we can see this dense black is all air, which is a normal air in the stomach, and this slightly blackish thing. So just compare the blackishness of this liver, which is a solid organ, which is a soft tissue organ. So it is more of a dense. The most radiodense or most dense white structure is bone. I have told this earlier so many times. Bone, blood, calcium. These three things appear dense white on the CT scan. So soft tissue will appear less white or whitish black or less radiodense. So this is soft tissue, this is liver, and liquid will appear less white than this. So it will appear more black than the soft tissue. So just compare, we can very easily notice this is a soft tissue picture density, and this is a fluid density. This is a fluid density which is kind of thick. So there is air, there is fluid. It means that this is actually stomach, which is kind of a normal stomach. You can touch this normal stomach here also. Now the next organ which we need to see, we have seen liver, we have seen spleen, we have seen stomach. Now we need to see the two kidneys. Now when we try to find out the kidneys, there are two kidneys on in the abdomen. There is one right and left, and usually they are of almost same size and same density. So this is the right sided kidney, which we can very nicely make out. And where is the left kidney? So this all large is all kidney. This all large is kidney. Now why there is this black thing in the kidney? So black thing, this is so dense black, this much dense black structure which appears on the CT scan is only and only air. So why there is air in the left kidney? There is not only air pocket, there are multiple small pockets of air which we can see in here, in here, in here also. So why there is small pockets of air? Because, and there is a large pocket of air here. So why do we get air? Is because of the digestion of something. So either it is food or a tissue which gets damaged, which gets necrosed which actually creates or liberates air. So whenever there is air, either it has to be in the gut system like a small intestine or large intestine or stomach, which is very common like this. Now as this is right side, we know that on the right side we have ascending colon. So ascending colon will have feces and air. So feces and air, there will be dot 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 dot. This is all feces laden gut. There is no inflammation, because if there is any inflammation, then automatically the gut wall will get very thick. In here, see, the gut wall is very thin. It is very thin. So if there is any inflammation, the wall would have been thick, but the wall is not thick, it is thin. It means that this is all feces present in the ascending colon, and definitely wherever there is feces, there will be gases. That is the reason why we get bloating, indigestion, and the patients fart. People fart because of these gases only. So these gases, they is perfectly normal, because this is gut system. The food is supposed to be there, the feces is supposed to be there, so the gases is supposed to be there. But in the kidney, we don't at all expect air at all. So the left side kidney is hugely enlarged. It is enlarged almost three times the size of the right kidney. See, this is the right kidney, and this is so much large left kidney with so much of gases. So gases is there, gases are present, means there has been a bad digestion of the kidney itself. It means there is infection present. Infection is there, which is actually causing so much of inflammation. That is the reason why there will be battle of the bacteria and our immune system, which is causing liberation of so much of gases. What we call it as emphysematous pyelonephritis. So whenever there is infection of the kidney and formation of pus, we call it as pyelonephritis. So how do we come to know that there is infection? Because whenever there is infection, there will be gases, there will be inflammation. Now how do we come to know that there is inflammation or not? Whenever there is inflammation, we need to understand one thing. We need to find out the fat in the abdomen. See, this is all abdomen only. This is skin, and the this all is fat. You can see all is fat. Now just always remember one thing: on CT scan, air is very black. Air is the blackest thing on the CT scan. So this is air, which is the blackest dense black structure. The next lesser black structure is fat. So this is fat, this is fat. So this fat has no inflammation, because whenever you get inflammation in this fat, there will be increased blood flow in the fat whenever there is inflammation, and this blackness will go, and there will appear small dense white fine whitish streaks of inflammation. So whenever there is inflammation in the fat, because abdomen is full of fat, so whenever there is inflammation, there will appear small streaks of white bands which suggest inflammation, which we call it as fat stranding. So fat stranding suggests that there is inflammation, means there is most of the time infection. So just see, as we know, this is the right kidney. So just see, the right kidney has a very well preserved margins. The margins are so smooth. The margins are so smooth, they are crystal clear margins. It means that it is very unlikely to have any inflammation. And just see this left kidney. So the margins are like they are all serrated. The margins are not smooth. Just see, the margins are not smooth. They are all irregular. And this is all fat, this is all fat, this is all fat. So this is all fat, and in this fat you have this whitish streaks, whitish bands which are there. So the margin of the left kidney is not at all smooth. It is so irregular, and there are dots nodularity, which tells that there is active inflammation damage going on around the left kidney, and there is fat infiltration by inflammation, which suggests that there is active infection. So active infection of kidney is as good as it is simple pyelonephritis. So pyelonephritis is kidney damage, which is very commonly associated with accumulation of the pus around and presence of gas. This is emphysematous pyelonephritis with so much of collection around the kidney. So you can see that this is all the collection around the kidney. This is all pus, because this is kind of liquid thing. So just compare the fat, which is this, and just compare this is more dense black. So this is kind of a liquid pus or liquid abscess which is present near the kidney, associated with fat stranding, fat infiltration, associated with so much of gas, suggestive of emphysematous pyelonephritis, which is usually very bad. So in this case we have to do DJ stenting to drain all the pus from the kidney to outside of the body, and we have to put a PCN or a pigtail to drain the pus directly to the outside, and we have to continue the antibiotic at least for 1 to 1.5 months till all the infection is completely cleared off. So this is a very interesting CT scan of the abdomen, which shows a very nice picture of emphysematous pyelonephritis with extensive gas formation, perirenal fat stranding, and perirenal collection of the abscess. That's all, and thank you.